Hola, mis amigos. Hello, my friends. Welcome back to my podcast entitled Suboxone Out the Monster. This is episode number 9. The purpose of the podcast is to get you off of opioids and transition to Suboxone. I am your host, Don Horner, or Dr. Don. But first I have to read a medical disclaimer to keep the lawyers happy. All information provided in this podcast is for educational and informational purposes only and does not constitute medical, nursing, or other professional healthcare advice, diagnosis, or treatment. Always seek the advice of your physician, pharmacist, or other qualified healthcare provider with any questions regarding any medical conditions or treatment. And now my favorite thing to say. Never, never, never take any drug or medication that is not prescribed by your healthcare provider and filled by your pharmacist. Fentanyl is everywhere out there, and fentanyl will kill you. So the typical story is you were addicted to opioids, and you got off of opioids and transitioned to Suboxone, and you were happy. Now you just want to get off of Suboxone. There are two reasons that people want to get off of Suboxone. Either you just want to get off of drugs altogether, or you're spending way too much money for Suboxone. Yes, Suboxone can be expensive, particularly without insurance. Usually either one or both of these reasons can be the cause, but it's your decision. Now, I've been caring for Suboxone patients for almost 9 years, and I've only had 2 patients who wanted to discontinue Suboxone. They both weaned down to the lowest levels possible and told me they were just going to stop. I never heard back from them again. I reached out to see what happened with them, but I never heard back, so I don't know what happened. As far as I know, they are out using street drugs, but I just don't know. For the most part, Suboxone is safe. Medical providers don't recommend stopping Suboxone because, for the most part, it's a safe drug. Because of the ceiling effect of Suboxone, where the drug opioid activity, like respiratory depression, where you stop breathing and die, and euphoria, where you get high, stops increasing after a moderate dose of Suboxone, usually 16 to 24 milligrams daily. Now, 16 to 24 milligrams daily is usually the recommended dose for Suboxone. For the most part, Suboxone is a safe drug. Before I go over the recommendation of getting off of Suboxone, 2 things are essential for success. Number 1, you must be highly motivated to discontinue Suboxone. And number 2, you must realize that you will be miserable for some period of time. Now, I have reviewed several articles describing the methods to get off of Suboxone, and all the methods are slightly different. So now I will give you my recommendations. First, Suboxone tapering. I don't think it makes any difference whether or not you taper fast or slow. Just get down to the level that you're comfortable with. Now, a medication like clonidine should be available, and this is a drug which is primarily used for high blood pressure and ADHD, or attention deficit and hyperactivity disorder. Clonidine is helpful in managing withdrawal symptoms by acting on impulsivity, attention, and heart rate. It has been shown to be effective in reducing the intensity of narcotic withdrawal symptoms. So have it around. But how long do the physical withdrawal symptoms last? The first 72 hours or 3 days are the most challenging. Physical symptoms include intense flu-like symptoms with fever, chills, muscle aches and pains, joint pains, increased blood pressure, and increased heart rate. Cravings during this phase are usually intense, severe inability to sleep, and vivid dreams when you do sleep. From day 3 through 7, acute symptoms decline. You get a little bit better. But now, weeks 2 through 4, psychological changes can occur with depression, anxiety, emotional triggers can set off these symptoms. The most important thing to do is to help your success is do not do it alone. Don't do it alone. Have a friend, a relative, or anybody that loves you to be with you for physical and emotional support. Make you vegetable soup, get you ice cream, rub your back, show love. I don't recommend using an ex-wife. My ex-wife would just love to see me suffer. Actually, she's a great lady, and she'd probably just shoot me in the head rather than to see me suffer. Just kidding. Of course, there are inpatient detox programs where you live during the process, but these are expensive. Again, just be sure that you want to stop Suboxone and realize that you will be miserable and in pain for a while. Now, in our next segment, I will interview another guest who has made the transition to Suboxone. Again, as I always say, just keep it in the road. Thank you. Oh, hello, ladies and gentlemen. Welcome back. And this is my next guest. Her name is Gay, and she's been one of my patients for a long time. She's a special person to me, and I think she has a fascinating story. Hi, Gay. How are you?
I'm good, thank you. How are you doing?
Good. I heard you had a birthday party last night.
We did. My grandson just turned 10.
Oh, congratulations.
Our youngest. Yes.
Congratulations. Gay,
Thank you.
This podcast is about trying to get people off of opioids and onto Suboxone.
Correct.
And we're trying to record stories by our patients who have made that transition.
Yes.
Gay, how old are you now?
I'm 68.
68. Okay. Now
Yes.
tell me, how old were you when you first started on opioids?
I think it happened when I was in my either late 40s or 50.
Okay.
Somewhere around then.
Okay. What was the circumstances where you started? Was it medical,
I
surgical?
I had pulled my back out at work, and I was out for a week, but I was, they put me on, it wasn't Percocets.
Yeah.
That's what it was.
Okay.
And it was like every time I moved, the pain it would spasm. It was horrific. The only time I had release of pain was in my pool floating. But anyway, my neighbor, she goes, well, try this. And it turns out it was Oxy, 30 milligrams. I have never taken it before. So I took one. I almost threw up. I didn't, it worked, but so I would take one, but I would cut it in half. And then as time went on, I would take more from her. She was on prescription medication. So it wasn't a street drug. So I was starting to buy them down the road from her. And then we went on a cruise, and we took the kids. We went to Disney World, and then from there, we were hopping on the cruise. Well, I had finished the Oxys before I got on the cruise, and I went into withdrawal. I've never even had a patient in my life with drug withdrawal, only alcohol withdrawal. But, excuse me, it was terrible. My legs would not stop running. I was hallucinating, actually, seeing Mickey Mouse running around the room on the ceiling. It was awful, and I had to tell, of course, my husband had no idea, and he said, what is going on? So I told him the whole deal. I was getting the Oxys, that I went on them, and I got them from our neighbor, and so anyway, when we got back from the cruise, I went straight into rehab right the next day. And my husband was working at a psych hospital at the time. When we were back, we live in New York on Long Island. And so he got me in right away. And from there, I was in there for probably a week, and I came home, but I was still in that withdrawal. Yes. And I couldn't function. I couldn't do anything. It was just horrible. It was like I can't explain it. It's a terrible feeling. And I just couldn't function, not even to wash dishes, nothing.
Now, was the rehab program you went into, was it inpatient or outpatient?
It was inpatient.
Inpatient, so you stayed
inpatient.
There. Okay. And
so
you went home after about a week.
Yes. And I said, I got to do something. So I went to my medical doctor, and I told him everything, and he told me about Suboxone. Never heard of it before. There was only a little pharmacy that had it. This is going back quite a while now. So
20 years.
Yeah. And I just never heard of it. So he put me on it. He said that the amount I was taking, like taking 9 bags of heroin a day. And so we started off at 2 milligrams, but it wasn't holding me. And so over time, we had to adjust it till I finally got to a level where I finally felt, okay, this is perfect. I feel functional. I'm not in that crazy, weird, nagging pain thing, whatever it was. And then I felt like a normal person. And then when we moved here, then I just switched over to different Suboxone doctors. Because the withdrawal was, like I said, was awful. And
Now,
I didn't even know if I... I'm sorry.
Did the Suboxone control your pain as well as your withdrawal?
Absolutely. Absolutely.
Okay.
Yes. Yes.
Well, that's 2 birds with 1 stone, so that's a great benefit.
Yes. And it kills, like, the withdrawal right away. So, but it doesn't get you high or anything. You're just normal.
Right.
Just like every day back to my normal self.
So you're able to function, eat, drink, drive,
exactly.
go shopping,
Yes.
do projects, okay?
Yes.
Make dinner, okay, wonderful.
Yeah,
Wonderful.
it was back to being me with no pain, and you're not getting high, you're not getting loopy or, anything like that. It was a miracle drug, really.
Now, Gay, what is your dose of Suboxone now?
It's 2.8 milligrams, or is it? I don't know. Maybe it's 8.2.
8.2. It's 8.2.
Yeah, that's what it is. Yeah, twice
How many
a day.
times a day? Twice a day. Okay.
Yes.
Great. And is that holding you pretty well?
It is, and it's for my back pain, and my left hip, I think, is starting to go.
Great.
So,
now, Gay, you said something about when you were in the hospital. Did you work in a hospital?
I did for 20 years at our hometown hospital. Yes.
What did you do at the hospital?
I was a nurse.
Ah, an RN.
Yes.
Okay,
Yeah.
good
LPN.
for you.
Yes.
Good for you.
And
Good.
I loved it. I loved hospital nursing. And after I left the hospital, I worked at a small little nursing home, rehab center.
Right.
And I had a private case that I had for like 13 years, the same person. So, and he was a quad. And I think a lot of it had to do with my back with him. He was, he was a big guy. He was like 6'2". He was muscular. He wasn't your typical quad. He could lift up his arms a little bit, but he was afraid of the Hoyer lift. So I had to do all the lifting with him.
Gotcha.
And he was like almost the same height as me in the chair. He was like, he would say that kidding, because I'm the same height as you, just sitting in my chair, but I could lift him. I was always physically very strong,
Well, it's a hard thing. I know what you mean. It was hard for me to give up clinical medicine also.
Yeah.
Okay, and I still miss it to this day. And
Yes,
I stopped doing clinical medicines 12 years ago. Yeah, I still miss it today. But we go on. Life goes on. Okay?
Absolutely.
Now, Gay, your family. Tell me about your family.
Oh, I have been married. Actually, we just had our anniversary. We're married 36 years, 39 years together. We have 4 children. I was married once before. So I have 2 children with my first marriage, and then we had 2 more children with my second. And he raised my 2 other children. They were very young when I left my first husband, and they were just a baby, an infant, and a 2-year-old at the time. So,
Gay, you have grandchildren too, don't you?
I have 4 grandchildren, 2 boys, 2 girls. Yes.
Wow, that's wonderful.
Yes.
Well, you're like Sherry and I. We make a lot of money babysitting our grandchildren. I know you do.
Yeah, that's true. In fact, the girl who does at the salon, I met her probably about 6 years ago, and she also she has a little boy, and he's like another grandson to me. So I was just babysitting for her last week, and then she takes care of my house and all my animals when we go away on vacations.
That's wonderful.
And so it works out really nice. Yeah.
Gay, do you have any withdrawal symptoms now?
No, none at all. No.
So you sleep, you eat, you do everything, and no withdrawal symptoms.
Doesn't affect my appetite. Nothing. It's wonderful. Yeah.
Well, it's good to hear.
Now,
Gay, you did tell me one time you had some difficulty with alcohol.
Yes, when my cousin, he was like the brother I never had. We were very close, and I was like the sister he'd never had, because he had a brother, no sisters, and I had sisters and no brothers. But we were very close, and he had a brainstem aneurysm, and it just devastated me. It was, that sudden death is terrible. He was a healthy guy, and then bam, he was dead.
Yeah, you don't have time to say goodbye, do you?
No. I flew down. He was in Florida for his son's wedding, and it just happened in the hotel where they were staying. They finished breakfast. He was walking out, and he started to fall. And he just said, "I'm sorry," and that was it. And so we flew down there. I had to see it for myself. I had to do his neural checks to make sure. I knew just by looking at the arms. What do they call that? Abraxas? I forget. When the arms start to turn in, I knew he was pretty much brain damaged and gone. So.
What's that called? Decorticate, don't they? Decorticate. Yes.
Yeah, and so we were there to pull the plug.
Is that when you started alcohol?
Yeah, exactly. And I remember saying to myself, well, I'm just going to drink because the pain of grieving is horrible, and I'm just grieving right now, and I figure I'll stop when the grieving starts to slow down or, be further away, maybe. But I didn't think I was going to get addicted, but I ended up getting addicted. So I've gone into rehab for that.
Is the alcoholism controlled now, Gay?
Yes. I've been to, took me a couple of rehab stints, but I did it. I can drink when I go out. We don't go out that often, but if we go out to dinner, I might have a glass of wine. We go out dancing, I might have something a little bit stronger, but I don't have alcohol in the house. I won't, and I don't crave for it at all. And I remember that last time I was in rehab, and I was pretty sick, and I was like, it's not worth it. I'm too old also. Because, women, we don't tolerate alcohol. We don't metabolize it like men do.
No.
It's worse for us. And and I've seen a lot of alcoholic patients I've had pass away. I mean, my youngest was 21 years old, female, who ended up passing away of acute alcoholism, cirrhosis of the liver.
That's
21,
terrible.
still have braces on her teeth, and
Terrible.
yeah. But a lot of young ones I saw pass away, and I'm like, look at you, and you can't drink this way. And it wasn't it was hard liquor.
So, Gay,
Right.
if you had to tell somebody who's on opioids and thinking about transitioning to Suboxone, what would you tell them?
I would say it's the miracle drug. You won't go through withdrawal anymore. It cuts that out. It stops it, and if you can do it, that's and of course go to therapy, and you really should do that also.
Wow.
But it's worked for me, and I have no cravings. It stops cravings too, so that's another good thing. You're not looking for anything else. I think with the opiates, it gave me this energy, and I was able, did more than, and that's how I got addicted to it. It's not, also because it started with my back being pulled out, but
Yes.
then it was like, oh, I could do more stuff even with this pain. It gave you a little bit of that energy, and I liked that. Not realizing, I don't know what I was thinking. I'm so dopey thinking about withdrawal or anything.
I understand.
Um,
Well,
yeah.
Gay, I want to thank you very much for coming on the podcast.
Oh,
Now,
well, thank you.
if we convert one person from opioids to Suboxone, then we will have done our job. Gay,
Absolutely.
this is God's work.
Yes,
We're
absolutely.
saving lives, okay, and that's what we
Yes, and
should
it's
do.
all in his hands.
It is, okay. God bless you,
Yeah.
Gay.
Well, thank you.
Enjoy that ice cream tonight, okay? And I'll talk to you soon. And Gay, don't hang up yet, okay? Just stay on the line,
Okay.
okay? All right, I'll
Okay.
cut it off here.